Rebecca Ivers. I'm Head of School, Professor of Public Health and Chair for today's discussion. Today, as always, we're meeting on Aboriginal land. We're here on UNSW campus on Bidjigal land and pay respect to traditional owners of all the lands we're gathering on today and to any Aboriginal and Torres Strait Islander people joining us today, acknowledging your contributions, both past and current, to knowledge systems, science and culture over many thousands of years. I'm delighted to welcome you to this discussion on behalf of the School of Population Health. The In Perspective Conversation series was designed to bring people together to tackle the big public health and policy issues we face. And today we've got a great panel lined up for you. In a time when doctor shortages and unpredictable health threats and climate emergencies are becoming the norm, we often face additional burdens of workforce shortages and unsustainable health systems costs. The big question for us today is, are there lessons that we've learnt from the response to COVID and the climate change emergencies about what we need to address the public health challenges of the future? With me today to discuss how to ensure the public health workforce in Australia is equipped to respond are three outstanding women. Amanda Larkin, Chief Executive, South Western Sydney Local Health District. Amanda leads more than 15,000 staff at South Western Sydney Local Health District as a Chief Executive, and she has more than 30 years of experience in health service management. Over the past few years, Amanda has overseen the health system response to COVID in the most heavily impacted and most diverse community in New South Wales. A huge challenge, and it's been an incredible challenge, and she's absolutely rose to it. I'm really glad to have you here today, Amanda.
Thanks, Rebecca.
Anita Desai, the Director, Cancer Prevention and Advocacy at the Cancer Council and Chair of the Cancer Council Public Health Committee. As Director, Cancer Prevention and Advocacy, Anita leads strategy and program efforts in the two Cancer Council New South Wales strategic priority areas of prevention and advocacy, with a focus on reducing the burden of cancer and reducing cancer risk across New South Wales communities. Welcome, Anita.
Thank you.
And last but absolutely not least, we have Elfa Meritakis. She's the CEO of Syd West Multicultural Services. Elfa's the CEO, the leading multicultural community organisation operating in Greater Western Sydney and the Outer West, Syd West Multicultural Services. Elfa's been actively involved in the community sector for the past 30 years and has an extensive background in developing services for linguistically disadvantaged communities. And it's a delight to have you here today, Elfa. Thank you very much. So, Amanda, over to you first. You lead a diverse LHD that was hugely impacted by COVID-19. From your perspective, what have we learned from COVID-19 about the strengths and weaknesses of the public health workforce?
So thanks, Rebecca, and it's great to be with everyone today and my fellow panellists. Just a little bit of background for those who may not be aware. So South Western is a large LHD in New South Wales. It has 6 hospitals, about 100 kilometres from top to bottom, a population of about 1.1 million and a very diverse population. Probably 50% of the people in the Southwest, English is a second language. We were significantly impacted by COVID and also the public health orders that were put in place in order to manage the spread of COVID in the Southwest. And I'm sure Alpha will talk a little bit. Alpha will talk a little bit about it in the future of conversation. But the issue was the impact for those communities was significant. When we look at the response from the health service around it, I think there are some really important things to take away in terms of the workforce's response. And I think what everyone's got to think about, as much as people were working and responding to the pandemic from the health services point of view, they were impacted as individuals and family members themselves and needed to manage their own families and their own communities that they were working in. So I think there are some really key things. The resilience of the workforce. And when I say resilience, the ability to come back every day, having to deal with such significant change. We produced a beautiful video recently where people said they started the day with one kind of approach to things and by the end of the day was different. So their resilience, their agility to change. Health has a particular way of doing business. We work on evidence-based practice. We look, we trial, we test because of the impact we have on people's lives. In this situation, the evidence was coming quick and fast and we had to change. So people were incredibly adaptable to that to that environment. And I think the other thing is that people showed in that time of significant stress and anxiety, they provided care and compassion to people in incredibly difficult circumstances. So when the public orders came in and people couldn't come into hospital and be with people, and people were literally by themselves, that hand-holding and the care and support that was given to people, I think when you think about it, was fantastic. And then the adaptability for the communities that we serve to really understand where people were coming from and understand their fear and concern, that workforce really had to adapt around the way it was working. And they did that every day and on a very much an ongoing basis. Because when you think about it, we went from Delta to Omicron, etc. So that focus for them. In terms of weaknesses, look, it was a challenging time. Did we in health get everything right, and did our workforce get everything right? No, we didn't. But they were absolutely working every day to get it as right as what they could for the communities.
Great. And how did the public health workforce pivot in the LHD? So for people doing contact tracing and all the other sort of aspects of the job that they needed to then take on top of their normal duties.
And that's a really important question, Rebecca, because I think from the structural point of view, to some degree, the public health units sit a bit to the side of the business. We know that they do a whole lot of really important work, but there is a very big focus on that acute sector. So what occurred in that time is that unit had to come very close to the business. They actually had to look at their systems, processes, and the way they were working, and they had to pivot, but also bring into their service a whole lot of people who were trained very quickly about contact tracing, etc. So that they had to teach and train people and really think, I think, very differently about the role that they normally would have had. And then they became the absolute focus for everyone in terms of going further. I do need to say, though, they did an amazing job, absolutely amazing, because they also had to change the way that they were working very quickly, and consistently over that period of time. They did an amazing job.
And of course, it's a whole new skill set. I mean, no one really knew how to do contact tracing before, 2020. So, again, everyone learning on the job as well.
And that's what they did. They literally teamed up people, senior people with less experienced people, taught, trained. And I got to tell you, contact tracers became kind of very much, the centre focus of everyone's discussion, where I think if we come out of COVID, everyone kind of learned about what contact tracing people do.
That's right. We all know what it is. So, and I just should say welcome to the audience. If you'd like to participate, please feel free to put questions in the chat. Should be a little comment box there that you can put comments in, and we'll answer the questions as we go and at the end. So welcome to all of our audience. Over to you, Anita. Thinking about the public health workforce and prevention, I think now in this kind of, and I won't say a post-COVID world, but in a world where we're dealing with COVID in an ongoing way, are we in danger of focusing too much on health protection in this new world we're living in and losing all those important gains in prevention that we've made?
Look, it's an interesting question because I think when I was thinking about this, you can't help but stop to think what was the, and Amanda's articulated it beautifully as far as what was the immediate need, what was the immediate response once COVID was really very clearly going to become a really significant issue for us to have to deal with. Under normal circumstances pre-COVID, and if we're thinking about primary prevention, we would have been, again, from a not-for-profit perspective, advocating on key issues to do with alcohol or tobacco control or food policy issues such as junk food marketing, and for Cancer Council around skin cancer prevention. And so from that point of view, COVID introduced a completely new factor whereby the noise and the focus around public health really immediately shifted to be on this pandemic response. And it meant that there wasn't the bandwidth and understandably the appetite for what would have been those business as usual policy priorities for us. And so it was a difficult moment for us to have to go, okay, well, look, the focus and attention absolutely needs to be on the immediate health system response to this particular crisis. But then obviously as the weeks and months started to evolve, quite interestingly, you start to see, where primary prevention's primary prevention comes back into the equation as far as where people who were being more adversely affected by the impacts of COVID were experiencing chronic disease, or their health behaviours were fluctuating as it related to, people staying at home or potentially consuming more alcohol at home. What was happening to tobacco consumption during that time, we knew that that was fluctuating as well. And so there were opportunities, I think, to both monitor what was happening with health behaviours, but also start to think about how do we calibrate what would be our ordinary policy priorities. If we fast forward, a few months and a few years, and as far as where we are right now, are we at risk, to your question, as far as focusing too much on the immediate health protection side of things? There are some really incredible opportunities, I think, for us nationally on the radar that does provide, I think, a balanced perspective. And if I think of, the National Preventive Health Strategy, again, that sets a 10-year framework for where we want to see the efforts of, primary prevention and activities such as screening really advance over the next few years. We've recently, I think just as of last week, seen the release of a discussion paper on a Centre for Chronic Disease Control, a Centre for Disease Control, I should say, and that's clearly calling out that discussion paper that prevention should be a discussion point and how to factor that into the short and medium term. And then there are those other really critical policy frameworks like the National Obesity Strategy and hopefully soon a National Tobacco Strategy. So I think the foundations are there to help us provide a balanced pathway forward as far as health protection and a focus on health promotion. But really selfishly, I will also bring it back to why it's so important for, in particular, the not-for-profit sector to continue to advocate and hold government to account as we advance both priorities equally around health protection and health promotion.
Absolutely. Now, Elfa, over to you. You lead a multicultural community organisation through COVID-19. You led an organisation. In a post-COVID world, what challenges does a community health workforce face meeting the needs of diverse populations?
Thank you for the opportunity. Let me start by saying that Syd West delivers a variety of services, including in-home aged and disability support care, nursing, specialist services such as refugee settlement support, women and family services, domestic violence, youth activities, casework, mental health sector support, and other regional smaller base services for people from migrant and refugee backgrounds in Greater Western Sydney. And why do I feel the need to say that? Because I think it is important for us to put things into context when it comes to workforce. A workforce that is not only health related, but was already working in emotionally difficult environments that led to vicarious and secondary trauma, compassion fatigue and burnout in a pre-COVID world, let alone in today's world. So in addition to, the challenges that we're identifying here today, the current workforce is faced with exhaustion, heightened levels of stress and anxiety due to what we have been through without any time to stop, reflect, debrief, but also the general uncertainty, the more complex work environment, the increased workload due to the current staff shortages that we all know about, and of course the responsibility placed upon staff to pacify and keep reassuring the people that they interact with that we're safe and that they will not experience another, division of the city between the privileged and the not so, that we're not going to go through, the same journey again. And recently, I think following the increase in numbers and the concern of a new COVID wave, workforce is concerned, as everyone can appreciate, of their own and their family safety being in the front line and exposed once again to the threat of the virus.
Thanks, Elfa. And I think it's fair to say that COVID really uncovered how badly we tend to communicate with diverse communities from a health perspective. We talk often about health literacy, but really it's the health system that's not literate. We're not really providing services or communication often in the correct language or in the right context. We don't really understand how diverse communities work well enough so that we can actually tailor the health services to them. And I know there has been a lot of inroads made, certainly in southwestern Sydney. But I mean, COVID really uncovered those big gaps, and it really wasn't, until at least a year or so in that, when we started actually, even translating those 11 o'clock press conferences, actually working with community leaders to actually get the messages out to communities, and we really started to see behaviour shifting because the communication was done more appropriately. I guess I'm interested in, from your perspective, what support would you need for your workers, for, people in your organisations who are working in this kind of context? Because a lot of the burden was pushed out to NGOs, to people that are obviously struggling, maybe not government funding, maybe not well funded, but then you have this whole sort of richness of staff expertise and, really many people who are the ones on the coalface. What would you say that you need going forward? If you're going to face that again, would it be more funding, more workforce, more training, more interaction with the health system?
Yes. I think more coordination on, all levels. And I think that what I felt and was quite evident to me during COVID was that especially our multicultural sector and our NGOs are not well acknowledged. That we have a lot of power because of the connections that we have, with our local and regional communities. If there was a little bit more coordination between all levels of government, ourselves and health, I think we would have, managed a lot better than we did. But it is, as you said, Rebecca, a lesson to be learned. And we're looking forward, because we know more crisis is, we're dealing with more crisis to come, and we should be prepared. So all these tasks what I would like to see is all these task forces that we spoke about during COVID that have seemed to disappear as we eased out of COVID. I don't want to see that momentum lost. I want to see that engagement, there in order to be prepared for anything, that might come along in the future. Absolutely. And I'm sure that Amanda will agree with that.
Absolutely, I absolutely agree. And I think as health workers, we do understand the real value of NGOs, non-government organisations, weren't only built to create those connections with community, but created, I think, the important thing, they create a trust relationship. So they have people locally who are involved, they understand the local issues, and often what we found is that people would go back to the NGOs because they knew and they trusted those agencies to give them either information or support, and were critical in terms of that coordination over the COVID. So going into the future, if we think about public health professionals and what are core skills, understanding the critical role of NGOs, the flexibility that NGOs have in the business of providing care and support in the community, and developing skills and training and knowledge about working with NGOs. So in public health, you have lots of people who have got quite strong community development skills. But when you coming out of COVID, understanding the critical nature of those skills and the role played by NGOs, I think that's something that needs to be taken on into the future into good public health training programs.
Absolutely. And also making sure that there are representatives of those communities and the NGOs at the highest levels of government as well. So decisions aren't being made and then funneled down, that people are actually present at the decision at those places where decisions are actually made. And that also goes for Aboriginal community controlled organisations as well. I think one of the other questions is around funding for NGOs, because I think we all are aware that, a lot of the work often does get shifted through to NGOs, but the funding doesn't flow. There's this sort of assumption that NGOs have got their own sources of funding, but often they're actually very reliant on government funding, which can be variable. So I think it's also worthwhile saying, well, if we understand the very important role that NGOs and community organisations make, we need to make sure that they're actually funded and staffed to actually take on those important roles. If we know that a government agency can't do that community work, we need to make sure that the NGOs and the community organisations are actually funded to do that, because otherwise it just becomes a black hole and nothing can happen. Now we're going to move on, and I want to ask all of you this question. It's just thinking about the the fact that the public health workforce is so multidisciplinary. There's not such a thing. You have a public health officer, you might have someone that's got a Master of Public Health, but that's actually only a very narrow, and this is speaking of someone who educates people with Masters of Public Health, that's not everything. We've got policymakers, people in health promotion, health protection, health communication, health literacy, data analysts and modelers, public health nurses working in immunisation, public health physicians, community pharmacists, and many, many more diverse professional groups. Now, with all the emerging issues we're dealing with, we have climate change, and we're seeing that at the moment with all the impact of all the floods, and we know that community displacement leads to trauma. We know that, the role of people dealing with mental health and the fallout of that trauma is needed. We've got pandemics. Do we need an even more diverse workforce? And how do we create training and career pathways for such a workforce? So, I guess we do have a diverse workforce. How do we actually bring it all together and actually make sure that there are career pathways?
So from my point of view, I probably touched on it in terms of, I think there are some important elements around our training that we really do need to build in. And if you look at our public health workforce, things like climate change and whatever are absolutely built in. But I think as we've seen over the last couple of years, the role of those elements, built environment, environmental health issues, and community development, i.e. working with community groups and NGOs, is essential. But also, I think the other big player is working with local government and levels of government, because what we talked about here was that the ability for New South Wales and Australia to respond to COVID needed all levels of government to be coordinated together and with good engagement, collaboration with our community. So everyone needed to be, and look, that takes skill and capability to be able to do that, to understand the different roles and understand, I suppose, the federal environment that we work in, which very much came to the fore. I think the other thing is about pathways, and I think we need to think that working directly in health itself is one pathway, but working with pathways with local government, other agencies and other NGO agencies is another way to build public health staff's capability and skills, not just only reading the theory about it, but going and spending, 6 months or whatever with an NGO, you get a deeper understanding of what it's like to work with communities and understand the issues from their perspective. So that diversification of training and how we provide that, I think we need to think very differently about.
Yeah. Thanks. And Anita, what's your perspective on this?
Yeah, look, I might work backwards from where Amanda just left things off. I think that that's a really interesting proposition, because I think for, the up and coming and rising stars, even from within my own organisation, who have built, who may have for a large part spent the majority of their career purely working in a non-government organisation, it's very difficult to explain the way our very complex New South Wales health system operates. I had the benefit of spending a very long time working within New South Wales government, so I've got that advantage. But, if there is an opportunity to look at, is there an opportunity to look at, secondments or a cross-fertilisation of skill set, the connection that we have to community and a very strong public health skill set, can that at some point be matched with, hands-on experience working either at a local health district level or working within the New South Wales Ministry of Health? I think there is something definitely in there. I think that the thing that I will call out, though, is to be able to have, I think, a greater coordination and a greater diversity across our workforce. It does come back down to capacity for me, and I think reflecting on, the way that the health system had to respond during crisis and during pandemic, to be able to facilitate that level of coordination that we're articulating between a not-for-profit does require capacity. And when that capacity was needing to be shifted from working, let's say, on population level programs or in health promotion into contact tracing, we lose our connection to, our ordinary contacts under, business as usual circumstances. So I think capacity and how we expand the public health workforce has got to be part of the equation. The other thing that I'm going to call out is that a couple of months ago, I had the really great pleasure of participating in a public health association. I think it was also jointly hosted by the Australian Health Promotion Association, a speed mentoring session for those who are wanting to develop careers in public health. And I want to call out that there is a very diverse skill set waiting and desperately trying to get into public health. We have people who are potentially nurses who have stepped away for career reasons and wanting to pursue a career in public health. They've completed their MPH but are not able to get their foot in the door. I spoke to, veterinarians who were wanting to, switch things up a little bit, people who were traditionally researchers but wanting to pursue a career in public health. And they had repeated and failed to get that foot in the door. And so we have, I think what I'm trying to articulate is we have a workforce that is diverse potentially, but we are not able to tap into them yet. And so it does come down to capacity and building the capacity and expanding our public health workforce for me.
Mm-hmm. Thanks. Look, and it is. I mean, we are talking about the future public health leaders, and how we create them. And what we're hearing is that we do need a much more diverse workforce, but we need to create the right pathways for them. And I think all of us agree. I think certainly for us, seeing our Master of Public Health graduates, Master of Health Leadership and Management graduates, I think we see a need for more entry level roles so people can come in from their postgraduate training into entry-level roles where they can actually get experience in the sector, whether it's community organisations, NGOs, the Ministry of Health, LHDs, but actually creating those roles and those pathways for people. And I really think it's important to make sure that we have an equity focus, because they can't be internships, they can't be voluntary roles, because then otherwise we disadvantage all the people from marginalised communities who can't afford to do unpaid roles to get experience, and we privilege, again, the educated and the wealthy into those positions. So it's really important to keep that in mind. Elfa, over to you. What about from your perspective?
Yeah, I'm elated that we all speak the same language here today, and I couldn't agree more with both Amanda and Anita when it comes to the coordination between government departments and all levels of government, the communication with the NGOs. I think that our state is doing very good in other industries when it comes in planning for future workforce. So in the health sector, I think that we need a reference group that we can all sit down, plan and partnership with industry, with universities, with TAFE and training organizations, with community providers and government. I think it is imperative because we know what skills are required for the future. So it is, I consider it our responsibility to sit down and have that discussion and start planning, but also holding governments accountable on the way that they can resource both the health sector, the university sector, the NGOs to make it happen. And a point that Anita touched upon is that we need to make sure that those pathways to migrant and refugees are easier when it comes to, the recognition of their qualifications or the local experience that they require to get into, the health workforce, because we see it that we do have skills that are there, but we're not utilizing. So how do we make sure that we leverage out of what we already have, in the country? So, we can talk about entry, level, as you suggested, bilingual, public health engagement roles, community workers like ourselves, we used to call it community engagement. It's as simple as that. At some point in time, it just simply disappeared. Then we saw during COVID that we need digital literacy, health literacy in general. And as you mentioned, Rebecca, it's not just about diverse communities, it is about, the general population. And another thing that we're lacking, I think, as a country, and we keep seeing it again and again in the community sector, is the early intervention part of knowledge, like how do we make sure that we don't address the issue at the end of the road, but we rather, address it before it happens. So yeah, there's a lot of areas that all of us can work together and, put out a plan and work in partnership to make it happen.
Now, we have a great question that's come through about how we define the public health workforce, and thinking about what are the skills and proficiencies needed to achieve the aims of public health. I think we can define core competencies, and certainly I'm on the executive of CAFIA, the Council of Academic Public Health Institutions, and we do develop competencies for public health training. But, do we need to develop that up more to, ensure that we say, well, this is what a public health workforce looks like, these are the core competencies, or is our workforce too diverse for that? So, I mean, I think it's an interesting question of how do we actually professionalise the public health workforce, and is there a public health worker that we can actually, define and then put some sort of skills and define some skills and competencies around that person?
So I'll kind of start some discussion around that. I think in considering that question, one of the things that COVID I really hope identified was the absolute critical nature of public health and its workers, their core competencies, their skills, the knowledge that they have around public health issues, and the application of the things, not just contact tracing, but the whole kind of the follow through once kind of a transmission was identified. People, I think, over that time really came to understand the absolute critical nature and importance of those skills. And we, I think, as a health system and as a community, really started to think about, well, what's the role of public health? What is this critical contribution they make to healthcare delivery, and the fundamental importance of prevention and secondary prevention around transmission, etc. Where before, I think we have really run a very hard argument when we talk prevention, because the community, in essence, wants lots of quick cures, quick tablets, quick cures around things. But what we learnt through COVID is that, yes, there's vaccinations, and that was one element. But if you look at the whole kind of a whole set of things, such as, hand washing, mask wearing, people came to understand the critical nature. And I think when I look at that question, everyone understanding those core competencies and capabilities, but valuing them in the health system, and then the application of those to the other things that we do in health is really one of the great things that I think have come out of COVID. What we've got to do is not lose it, but build on that going forward.
Yep. Look, and I think Emily Banks said this at one point, which is that public health is the answer to just about everything. And I think we all probably really believe that. I think we get public health into everything. Alpha, Anita, any comments on that, on the public health workforce?
Not really. I think that Amanda covered it very well. But if I can just add, during the time of crisis that we went through, the way that we, at least as an organisation, and I'm sure all other multicultural organisations in the different regions, work together with health to make sure, Amanda keeps referring to contact tracing, making sure that we follow up people that spoke a language other than English, to make sure that the community around them are safe, but they themselves are safe, was, it was work that was not funded. It was work that was not guided by, anything. So the way that organizations, health, individuals stepped up to make sure, that we kept the community safe, I don't think that we will ever be able to capture it. And, I hopefully I'm wrong, but through a university research paper, the amount of work and the impact that it had during COVID, on the safety of individuals. So I just felt the need, to say that.
Yeah, and I think we all really need to acknowledge very loudly and firmly the critical role that organisations like Syd West Multicultural Organisation and others actually did in actually ensuring that people in the community were safe, and the hard work that you put in, the hard yards that you put in towards doing that, because you understand the community, you had community links. So I think it really is, incredible work that you did, and I think we're all very thankful and acknowledge that. We need to make sure that visibility, though, as you say, is maintained, not just for the work that you do and the funding, but then in the decision-making processes going forward. Anita, did you want to comment any more on the competency or the pathway?
I think briefly from my perspective, and, of course, this is going to come from a more of an advocacy point of view, but if I look back at where we have made significant gains in achieving our public health aims and our goals, I do need to call out where there are some blockages, and I think sometimes where we have been challenged, it's when we fall into the political cycle. And so I think there's recognition of the fact that there are different agents. It's not purely the pursuit of those that work, day in, day out in public health, that the role of really important political leaders, the role of people who hold quite powerful positions to set the direction, set the vision, holding accountability to, the actions that we set out to achieve under key health promotion or public health strategies is really, really vital. And so from that perspective, I think Amanda touched on beautifully about those softer skills around, being resilient, being adaptable. I would absolutely call out, being accountable and obviously having a vision for public health and that commitment to want to see it through. And I think sometimes where we haven't been as successful in achieving those goals and those aims is that we haven't necessarily had that political leadership. However, obviously where that has been present, we have made really significant gains. And I think tobacco control is a really great example of that.
Great example.
Absolutely. Yeah, I was just going to come back to that and say, and I think advocacy is a key public health competency, and it's actually not just something that happens on the side. It's a key part of public health work is advocacy and actually calling things out and actually addressing them. So I think certainly the work that you do is critically important. And I think if you think about tobacco, alcohol, I mean, for me, who works in injury, actually, even in road safety, seatbelts, all of those things are really important. Now, I want to come back, though, to the next question is just thinking about health leadership and management. And this is key to a good public health response. And I think one of the things that really came out, and I think it was Kerry Chant that actually said this to me, which is that we were having a conversation about the workforce, because we, as many other universities, supplied hundreds of students and staff to COVID efforts for modelling, for contact tracing and other research that went on in the background. And we too had to make do with a severely depleted workforce so that, we could, really contribute to the COVID efforts. But Kerry had said, well, one of the things that was really obvious is that for what they actually needed for the COVID response was people who had public health training, but they needed people with leadership training and the ability to make decisions, and people with a good dose of common sense. And those three characteristics were really what was really critical for people for them and the workforce, because you needed people who could step up, assess the information, and then make decisions. Amanda, was that your experience as well?
Very much so. So it was a great reflection from Kerry, because we had a lot of discussion around it. So if you look at, say, the public health units themselves, great mix of different clinical people, from medical to allied health to nursing to public health professionals, etc. But what we felt was really essential is that it needed a very good injection of leadership and management. Leadership was there. I think that's not but management in terms of systems, processes, structures, being able to adapt the system quickly, and I think those areas would have really assisted in terms of some of the responses, because we were asking these teams to change and adapt and create rosters and do all these things that, really in the run-of-the-mill work is not done either quickly or not a lot of it. And so what you had was people who we really needed to be providing some of the direct service delivery being caught up on all of these issues over here. So what we came away with is that the importance of actually building into public health, the management skills and capabilities to support the direct work on the ground was absolutely essential. And we've taken that away in terms of thinking going forward, what's required there. And I think there's a piece of work there that they're also saying we can diversify the workforce in public health, and that's really important. But it's also important to identify that there are some core skills around management of this work that's essential in terms of going forward. And we will learn from that and actually start to build that in terms of our structures. Yeah.
Yeah, there's nothing like being in the middle of a crisis to see where you actually get leadership from, is there?
Oh, yeah. But the other thing is, if I can just add on to the end, people also stepped in. People stepped in and said, okay, you haven't got that capability. All right, how do we work with you? How do we collaborate? How do we get that in place? And look, I think that's where I probably opened with that whole concept of resilience and agility, that people who perhaps hadn't really understood enough about public health stepped in and said, we'll provide you with support, and away it went. Yeah.
Now, I'm just going to pivot straight to another question to you, Alpha, just thinking about the public health workforce ability to communicate with diverse communities was also essential to implement policy successful in the pandemic. So what did it teach us about how we need to develop our workforce understanding about how to work and engage with diverse communities? What are the lessons you've learned from that? Oh, we've lost sound.
Rookie's mistake. I was on mute. I think that, as Amanda indicated at the beginning of our conversation, we did make a lot of mistakes, but we did, we do have a lot of successes that we can showcase. I think that our attitude towards diversity altogether needs to change. I think that our multiculturalism should be seen as a strength. Up until today, we look at it from a lens of a deficit and a challenge. And I'm a little bit concerned that if we're hit with another crisis, we might be faced with exactly the same challenges as we faced previously. So I think that we need to make sure that when we engage with diverse communities, we do have that one single point of truth. And that, requires, it goes back again to conversations between all levels of government. In that way, we can ensure that we have consistency. We can avoid, information fatigue like we experienced, during COVID, coming from a lot of different sources. But I also think that we need to involve, our community leaders, our religious leaders, our organizations, to ensure that whatever message we convey to communities comes within the cultural context. And it is presented in a way that it is acceptable and it is received well from each community. And of course, I'm not in any way suggesting that it is easy to do so, but it is necessary if we're talking about, treating communities the same. It is a matter of, equity. And Absolutely. We should never forget and leave our vulnerable communities behind. And I also think another element is around assumptions. We should never make assumptions on behalf of our communities. And having said that, even as a multicultural organizations, we ourselves made assumptions. So when, we locked up our offices and we, sent everyone home, we just made assumptions that all our staff had access to laptops, that had access to the internet. So all of us need to be, educated in that area. It doesn't mean that because we work within that diverse sector, we know everything, but lots of our heads together, can find better ways, but definitely keep community involved in all those conversations that we're having.
Yeah, look, and it really does raise some interesting questions about workforce and leaders as well, because I'm just thinking about funding for those kind of positions in multicultural organisations and thinking about career pathways. So if we acknowledge that having people within NGOs and multicultural organisations are critical to actually implementing public health policy, how then do we support those positions and ensure career pathways, ensure that those roles have got public health competencies built in and they're linked into the broader public health community? I think that's a question, and thinking about how do we, and likewise for you, Anita, thinking about, in other NGOs working in prevention, because there's a whole lot of community NGOs out there. How do we actually integrate that workforce? We have public health officer training programs in the Ministry of Health. We have people based in LHDs, but how do we actually, I think it's interesting to think about how then do we create career pathways or networks that sort of encourage training, support, mentoring and communication between all of those people. Is there a need for us to actually think a little bit more imaginatively about what the public health workforce actually is and how we support it?
And I think you've hit the nail on the head there, Rebecca. I think there's a need to have a conversation, because I think at the moment we're slightly taking a bit of a siloed approach as far as looking at, the public health workforce that's within the health system. And there's the public health workforce that also sits outside the health system. And Amanda's spoken to the fact that there is a public health workforce at different levels of government as well. So I think that there is an opportunity to look at how we can better network the respective, what has felt a little bit more siloed to date. What are the opportunities for sharing that skill set, sharing that knowledge, opening up opportunities? But obviously, going back to the part that a point that I spoke about earlier, I think that that there is a workforce that is wanting to crack in as well. I mean, there are such a diverse range of skill set for people who have completed their Masters of Public Health, who are trying to get that leg up and trying to find an entry level position. And you're right. I think if I reflect back on the speed mentoring session that I attended earlier in the year for those students who had completed an MPH or just about to sit there and have to say, we could offer you a volunteer position. If you'd like to register with Cancer Council New South Wales, and we can look at what volunteer positions. It doesn't really. It's certainly not something that maybe inspires or really wants to set your heart on pursuing a career in public health. So I think there's definitely ways to diversify as far as skill set across those silos I spoke about, but also looking at how we really nurture the public health workforce that is trying to get their foot in the door.
And do you think we've got a comment coming in? What's the state government's role in expanding, enhancing, diversifying the workforce? Is it up to the state government? What about the universities, the federal government, NGOs and CAFIA in doing this? Do we all have a part to play, or is there, who should we be looking at for leadership in this space?
So I think what the pandemic has kind of put out there is, what does the public health workforce need to look like in the future? And how do we collaboratively across those levels of government with community and NGOs start to think about, what are the skills and what's the training, and how do we actually take it in the future? I mean, if I can just say that for New South Wales, one of the issues about the response in New South Wales is that and don't take me for granted, don't take me for word here, but I think it's either 50s or 60s, made an ongoing commitment to public health units, in LHDs like Southwestern. And so there was an absolute commitment to understand, yes, we need to fund hospitals and community health services and whatever, but we also see the fundamental role of public health units and the staff and skills that are in there. So that was a great investment many years ago that allowed New South Wales to respond in that decentralised way, although the system was managed from the centre. So there was that lovely balance. So thinking about, that, all levels need to consider what does it look like going into the future. And I think the pandemic has really heightened that. But also, can I just go back quickly, Rebecca, and talk about there's the whole lot of things about having secondments and whatever, in places like health service, etc. But Southwestern actually funds positions, and they are, in my mind, public health positions into councils who don't work in straight public health areas. They work in community development, they work in planning and creating good public health policy in those agencies. And that's, to me, the kinds of openings that we need to move people through in terms of skills, because that link with local government, that link at that local level, same as why wouldn't we fund some of those kinds of positions in community agencies to better understand how to engage with the communities, on a day-to-day basis. To me, it's that diversification that would be really great.
Absolutely. I mean, and that's really ideal. And I think it comes back to public health everywhere. I mean, that's what we need. We need everyone to be thinking about public health. I think one of the other things to think about is also people working in community organisations, having them seconded into other roles in other organisations so they can actually see how things work, and you have better two-way communication. I think we often do one-way secondments where people are sort of seconded in at a level, health people are sent out, but we don't often bring people in. So I think that's another way to do that. I think one of the other things that I would just like to tackle on, and we are starting to run out of time now, but thinking about how we tackle health inequities, and I think COVID's really put a big lens on that. It's really, we've seen where the inequities in society are, and that's really highlighted that. What does it mean about training future public health leaders and workforce? I think we're all learning that data need to be disaggregated. We always need to actually look at who is being impacted the most, and then thinking about where how much benefit you're going to get when you put programs in place, who needs it most, thinking about equity, making sure that our investment is in fact proportionate to the burden. What have we learnt about that? I mean, I think coming back to you, Anita, thinking about health equity, how should we go in the future in addressing health equity? What should our investment be?
Look, I mean, I think that there are some really clear call-outs already. I should start by saying, I mean, I spoke earlier about the fact that we have some very clear foundational governance frameworks, for want of a better word. I think if we think about, the Centre for Disease Control, the National Preventive Health Strategy, the National Obesity Strategy, we have these really big governance documents that articulate what are these really big public health goals and gains that we are trying to achieve over the next 5 to 10 years. And then within that, each and every single one of them call out the issue of equity. They call out which priority populations we need to invest more in to help support a more equitable outcome when it comes to health promotion. So I think that there isn't anything new there. I think the focus is there. There is a broad commitment. It's making sure that there is, adequate, Rebecca, your question as far as adequate funding to absolutely see it through, that we're not having loose language that says we will explore doing this, or, we may investigate doing this, but, potentially really putting some hard actions in place, looking at where there are opportunities to partner with community organisations to help design solutions with community. But it does require investment. Does require a little bit of letting control and actually working truly with community to help design those solutions. But if we kind of go back to the drawing board, I guess what I'm suggesting is I don't think we need to do that. I think that there are very clearly articulated goals. There are very clearly articulated inequities in key populations. So funding is an aspect of it, and making sure that there are the resources, both the public health workforce and the funding, to help really speed up action so we can actually deliver really important public health outcomes for those communities.
Great point. And I think actually we come back to the federal government and all the new strategies that have sort of have been rolled out both by the previous and the current government. All of those strategies we need to make sure that they've all got funded implementation plans behind them, because the strategy is only as good as the funding behind the implementation. Absolutely. So Elfa, I think what we might do is just start to wrap up. We're nearly out of time. What I'd like to do is ask each of you, and just to come back in a minute or two, what's the most important lesson you've learned from the experience of COVID for the future public health workforce? And practically, how can this lesson be translated into action that will help ensure the health workforce is prepared to respond to unforeseen events? Elfa, I'm going to ask you to respond to that first.
Yes, I'll just repeat something that I said before about the most confronting lesson for me, how unrecognised the social sector, and in our case, the multicultural sector, in our connection to the leaders in our local communities was. A sector that is professional, accredited, and strongly connected, that can support all levels of government in the communication with diverse communities. I think also that one of the most important lessons was that when responding to crisis, we need strong leadership, but we all have a role to play to support government. So we need government coordination, community and sector consultation and representation, as you mentioned, Rebecca, because I feel that responding to a crisis is not a one-man show or a one level of government, or one agency responsibility.
Absolutely. And Anita?
I think thinking about it really broadly as a very broad public health workforce, I think that, we're all in very furious agreement around where there are opportunities to strengthen coordination. And obviously capacity is a really big aspect in that for me. But then also just picking up on one of the comments that was put in chat as well, there are, and at a more individual level, I think where I certainly saw leadership in the public domain, but also leadership in up and coming public health stars, those that are rising through the ranks. It's those softer skill sets around resilience, around accountability, their ability to influence, to be able to steer a course, for them to be able to articulate a vision. And I think when we think about those who have committed and set their heart on pursuing a career in public health, and particularly in health promotion, that's a long-term investment to try and see gains that are very hard fought over very many years to try and to bring about policy change. It doesn't happen overnight. And again, that requires a degree of resilience. So I think it's that balance of, the really large public health workforce where there are opportunities to strengthen coordination, but at an individual level, not losing sight of those softer skill sets that really do create those future health leaders.
Fantastic. And over to you, Amanda.
So I think three things. There has been so much learning out of COVID-19. We'll reflect on it, and there'll be very many research papers I know that will be written over many years. But I think really important, a couple of important things. And there was a question in the chat. Effective leadership in public health, in the broader context of public health, in the overall roles of management and leadership. A deep understanding of public health principles is absolutely essential. And it came to the fore in COVID. You really need to understand, really about those core elements of public health. That's the first one. The critical nature of communication. And when I say communication, I'm talking about communication that is targeted, directed, consistent, multifaceted, so that all the community understand the situation that we're in and the responses that are required. And we saw that played out in many, many different ways over the time of COVID, and we got better over time. But the essential nature of that effective communication strategy, and to me, it's one of the core skill sets of effective public health practitioners, are being able to communicate at different levels and different and different ways of communicating. And I suppose the last thing, which is a bit philosophical, but please put it in context, is no one gets left behind. Okay? And that's really essential, that when we think about the strategies and we think about the public health orders that were put in place, they have to be thought about in the broadest context, that everyone can come forward, everyone can come through the process. And at times, I'm not quite sure that was thought about strategically enough. And we saw what happened was groups in the communities and whatever did get left behind. So our strategies then had to be very targeted. So we have to bring everyone, and as I said, no one gets left behind.
Well, on that note, I think it's a wonderful way to end. Thank you so much, Anita, Elfa and Amanda. This has been an absolutely fascinating discussion. I think we've covered off on, many aspects of public health training. I mean, I think we're all in agreement, on the need for diverse public health training. I think giving people a range of experiences, appreciating and acknowledging the diverse skill set that's required for a true public health workforce. And, I think not everyone needs the same set of skills. We do need people with a diverse range of skills. I think clearly heard from everyone about the important role of leadership, communication skills, the need to really acknowledge the skills and the strength of the public health workforce in the NGO and multicultural community setting. That has been absolutely critical to our getting through the COVID crisis. And I think I really would like to just acknowledge that. And of course, the important role of prevention in all of this, and maintaining that important focus on prevention and advocacy throughout all of this, because of course that's what's going to actually drive a future healthy and safe community. If we don't keep focusing on prevention, we're going to be in big trouble. So thank you all of you for joining me today. It's on behalf of the School of Population Health at UNSW. We really appreciate your contributions to our seminar series. Thank you to everyone in the audience who's listened in and sort of added in questions to the chat. Thank you, everyone, and we look forward to seeing you all at our next event. Thanks very much.